Hi, my name is Donna and I'm going to be doing a newborn assessment on baby girl Jones here. So I'm going to perform hand hygiene first before I do that. All right, and so before I get started, I'm going to go ahead and check her band on her arm. So on her left wrist is her name band. It says Baby Girl Jones. Her date of birth is 6/20/20. It has her MRN number and her band number. I will compare that number with mom's number just to confirm that they match. And then also on her leg is her security tag. So on her left ankle is her security tag that also has a number on that I'm going to be making note of. All right, so baby girl Jones was born today, like I said, 2 hours ago. Her mom delivered spontaneous vaginal delivery, and she had spontaneous rupture of membranes as well with clear fluid, no meconium. Mom was GBS negative. She did not have gestational diabetes. Baby was AGA. She weighed 7 pounds 13 ounces. Her FRs were 8 and 9. She breastfed following delivery for about a half an hour, 15 minutes on each breast. So that was wonderful. Mom was O positive. So baby's blood type is not known yet, as her labs are still pending. Her cord blood to get sent to the lab. So we'll wait to get those results of her blood type. So I'm going to, before I get started on her assessment, I'm going to go ahead and do her vital signs. So I'm going to go ahead and listen apically for her heart rate. And then I'm going to listen bilaterally to her lungs. And I'll be listening for about a minute to her lung sounds. And then I'm also going to take her temperature, and I'll take that under her arm, so axillary temperature. Okay, so her heart rate was 132, her respirations were 48, and her temperature was 98.6. Okay, and then beginning her assessment, I'm going to look at her head. And I'm going to be looking at her anterior fontanelle and her posterior fontanelle. I'm going to be looking at her sutures for the proximity and or if they're overriding, which they could be. I'm also going to look to see if she has any caput, if she has any cephalohematoma, or if she has any molding. So the molding, she could have that from delivering vaginally. All right, so her head looks good. Put her little hat back on here. All right, and then looking at her face, I'm going to be looking for symmetry of her face. So her eyes are spaced evenly bilaterally. She has no discharge from her eyes, and her eye movements are appropriate as well. Her nose is midline. I'm going to occlude the one nary and check for patency of the other nary, and then I will occlude the other nary and check for patency of the opposite one. I'm also going to be looking for nasal flaring. And there's no discharge or drainage from her nose. Her lips are pink and moist. Her mouth is midline. I'm going to insert a gloved little finger into her mouth. Her tongue is pink and moist as well. And I'm going to test her suck reflex while I have my finger in her mouth. And while she's sucking, I'm also going to be checking her palate. So her hard and soft palate, I just want to make sure that they're intact. I'm also going to check her rooting reflex, and that's where I'm going to just stroke her cheek, and she will turn her head toward that side that I stroked. And if I stroke her other side, she will turn her head toward that side as well. So as she turns her head, that also allows me to check for range of motion of her neck. Her ears are, they are bilaterally even, they're set evenly. There's no anomalies noted. We won't do her hearing screen until after she has her bath, which will be a few hours, when she's a few hours older. She will get those results. We will get those results right away. And then for the back of her neck, I'm just going to look for any webbing to see if there's any webbing on the back of her neck. And then I will check her clavicles to make sure that they are intact and no fractures. I'm going to check brachial pulses bilaterally. And then I'm going to check the symmetry of her arms. So they are the same length. They have symmetrical range of motion, good range of motion. She has 5 fingers on each hand. I'm going to check her palmar creases on both hands. I'm also going to check her palmar reflex. So I'll put my, just stroke her palm of her hand, and she should close her fingers around my fingers. So I'll do that to both hands. I'm also going to check for the Moro reflex. So that's where I'm going to lift her up by her arms, just letting her head on the bed, and then I'm just going to let go. And she should do a little startle reflex. So that would be her Moro reflex. So she has good strength bilaterally. So it's very, very symmetrical in both of her arms and good muscle tone. All right, following that, I'm going to move down to her chest, and I'm going to look for chest symmetry as well. So I'm going to look at her nipples. So she has 2 nipples. They are spaced symmetrical on her chest. She also has 2 nipple buds as well. Her chest appears symmetrical. As far as the rate of her respirations, they are spaced evenly. She has no, it looks effortless. She has no grunting, no retracting, no use of her accessory muscles. So I am going to, while we're looking at her chest, I'm going to go ahead and listen to her lungs. Okay, so I'm going to listen to 6 areas on her chest for breath sounds. Okay, they sounded good. I will be listening for any adventitious breath sounds. I'm going to also listen laterally. I'll listen to 2 areas laterally. Okay, they sound clear. And then I'm going to be also listening posteriorly, and I'll be listening to six areas on her posterior side. Okay, they sound clear. So that's good. Get her wrapped up a little bit here. All right, so next I want to listen to her heart. And I'm going to use my diaphragm and listen to her 5 different spaces on her chest for heart sounds. So beginning, I'm going to start with right sternal border, second intercostal space, the aorta. And then I'm going to move to her pulmonary, and that's left sternal border, second intercostal space. Then I'm just going to skip over Erb's point, and I'm going to go to her 4th intercostal space, left sternal border, and that would be her tricuspid. And then I'm going to go to her left midline clavicular, and that is her mitral. Okay, so then I'm going to turn it and use my bell, and I'm going to do the same again. So I'm going to do her mitral, and that is left midline clavicular, 5th intercostal space. Then I'm going to move up to her tricuspid, which is left sternal border, 4th intercostal space, and that's her tricuspid. And then I'm skipping Erb's point again, and I'm going to her pulmonary, which is left sternal border, 2nd intercostal space. And then I'm going to her aorta, which is right sternal border, 2nd intercostal space. And then I would be listening apically for any murmurs and for her heart rate. So at her aorta and pulmonary, I'm going to be hearing her S2 sounds, and then at her mitral and tricuspid, I'm going to be hearing S1 sounds. All right, so her heart sounded good. There was no murmur noted that I could hear. All right, so then we're going to move on down to her abdomen, and I'm going to be inspecting her abdomen for some symmetry, Also any markings. So as I look, I will be assessing her skin as well while I'm doing the assessment. I'm going to be looking for any birthmarks, any abrasions, any and her color, like her color is so far is pink, and I'll be looking for lanugo and vernix. And as I do my assessment, I will keep my eye out for all of those things. Okay, so back to her abdomen again. I'm going to be looking at her cord, and her cord, since she's only 2 hours old, is going to be moist. It will have a clamp on it. It should not be reddened around it. It shouldn't be showing any discharge. And there should be no hernia there. I don't see any hernia. And then following looking at the cord, I'm going to go ahead and listen to her bowel sounds, and I'm going to listen at all 4 quadrants, beginning with the right lower quadrant. So right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrant. Okay, so her bowel sounds are normal. And following the auscultation, I'm going to palpate gently, and I'm just going to look for any masses or any distension. Okay, and that sounds good. While I'm here, I'm also going to get her femoral pulses. Okay, and they are symmetrical bilaterally. All right, so we're going to cover her up again here and get her little legs out. Okay. All right, so looking at her legs, I'm going to be looking for this, the leg length, that they're symmetrical, and they are, and that her range of motion of her legs are symmetrical as well. She has good muscle tone in her legs, and I'm also going to look at the bottom of her feet. I'm going to look for the plantar crease, and that is in both of the bottom of her feet bilaterally. And I'm also going to look for the plantar reflex. So that's when I rub right behind her toes, and she's going to curl her toes around my finger. So that is symmetrical bilaterally. I'm also going to look for the Babinski reflex. So that's when I just take my finger up the bottom of her foot, and her little toes will spread wide. So that is the Babinski reflex and the plantar reflex. All right, so her legs look good. All right, so next we're going to go to her back. Okay, and on her back, her spine is central and straight. And then I'm going to be looking for the sinus or the dimple or a tuft of hair. So I don't see any of that. I'm also going to be looking for her gluteal folds as well. Okay, so that looks, her back looks great. And here again, I'm assessing her skin as I go for any birthmarks or any noted markings. Okay, so then we're gonna take her diaper off and look at her bottom. Okay. All right, so when I take her diaper off, I'm going to look if she voided at all. If she voided, there could be uric crystals in there, and that's normal. She could also have pseudomenstruation, which is normal finding as well. That would be a little bit of bleeding or mucus in her diaper. And then also, if she's had stool, it would be meconium at this time, which would be black stool. Transitional stool does not come for several diapers later. Okay, so looking at her bottom, since she is a little girl, I'm going to be looking for her labia majora and minora. And then I'm also going to be assessing her clitoris, her urinary meatus, her vaginal opening, and her anus. And they're all midline and looking good, no problems there. Okay, so her bottom looks good as well. All right, so she did well. I'm gonna just wrap her up nice and warm again, and then I'm gonna go ahead and hand her off to her mother to be cuddled again. Thank you.